Us, we're going to take a look at health, and today we are going to analyze the strategy of herd immunity and how efficient this can be in eradicating COVID-19 in the country and of course the world over. This is a virus that has given medical experts a hard time across the globe, and obviously as we grow to learn more about it, we shall be finding out whether or not this can be applied to particularly the African countries which have a very strained, or rather many different strained health sectors. So as it is, so you can imagine this being an undertaking by whatever we have right now. But of course, we're going to be engaging the experts on this one. Later on, we shall be joined by medical Dr. Samrat Shah. But in studio right now, we have Professor of Child Health and Pediatrics at Moi University, Samuel Ayaya. Welcome to the show, Professor.
Thank you.
Now, as we get into it, let's just start off with the basics. Let's define what herd immunity is.
Thank you. Good morning. Herd immunity is a situation where the people who have been infected by a virus and become immune protect those who are not immune. Now, this occurs when about 60% of the population, 60% of the population is infected.
Yes.
But for COVID, it has been shown that we need at least 80% of the population to be infected for us to achieve herd immunity.
Yes.
And by that happening, then we shall be able to stop the transmission of the virus.
Now, herd immunity has been known to stop diseases such as smallpox in the past. But right now, this is a disease that, of course, we do not know whether or not we can actually be immune to it, because studies have shown those who tested positive had an immunity for a specific time. So when you say that we should have everyone, intermingling and perhaps building up the immunity by getting this infection beforehand, how sure are you that this is going to be a solution? Because we don't know that people can actually become as immune to it as, say, other diseases, and particularly given that there are certain dangers to getting the coronavirus.
Well, I have not said that people should intermingle and whatever. What I've said is that for us to get herd immunity from corona-19 virus, then at least 80% of the population should have the infection.
Okay.
Now, herd immunity can be achieved in two ways. Either you have a vaccine and you immunize most of your people, or you get it from infection, or both. For instance, measles, we get lifelong immunity because we have the wild virus in our environment, and then we immunize. So the wild virus actually is the one that invokes most of the immunity, and then the vaccine adds on to that. So for COVID-19, it is a bit early. We do not even know how long the immunity will last. So we are still learning about the virus. But as of now, it is estimated that for you to be able to talk about your population having herd immunity, then 80% of it should be infected.
Yeah, but then I'd like to welcome Dr. Samrat Shah, who's a medical doctor, into this conversation. We have established already that to gain herd immunity, we need a certain percentage of the population to get infected or perhaps exposed to the virus. But of course, there are dangers to this. Could you explain to us what your take is on herd immunity and why we are not going in this direction, particularly when it comes to COVID-19?
Morning. I would like to add about this. See, herd immunity, when we talk about, we are talking about 80% of population getting infected with COVID-19. Let's understand the fact that right now we have only 3,000 cases in a population of 50 million. Let's understand that we have a population of huge population of that 5 million, and then we have 2,000 or 3,000 cases as of now. If we are talking about 80% of population getting infected, it means we are looking at around 40 million people getting affected, of which I think 3% of our population is elderly population, which means we are planning to have 1.2 million deaths. High risk population is more than 65 years of age, and they are around 3%. And if we talk about HIV cases in our country, we have around 6% of patients who are having HIV. So we are adding on another 300,000. So I think when we talk about herd immunity, we cannot afford to have 1.2 million people putting at risk, which are elderly population. We cannot put in risk for all the HIV patients, cancer patients whom we have. And we don't even have that much health infrastructure to accommodate 1.2 million. You see, this is not something which is feasible right now, because there are two things about this. One, we don't know how long the immunity will last, because there are reinfections being seen. That is one thing. Second thing, we don't know whether the population which is to be infected is going to have that amount of immunity, because the amount of antibodies required to have that prevention of infection and the amount of antibody required to develop immunity are totally different. What we test in the lab and to what is required may be different. We have no data about all these things. So I don't think so right now it is feasible to talk about herd immunity in case of COVID-19, because we lag a lot of information about COVID-19.
Yes, and Professor, I would like you to respond to that, because we do know that even with a few thousands of people that have been infected with COVID-19, hospitals are still struggling there. We had the example of some hospitals in Nyanza where that already have only have 10 beds and 9 are occupied. So when you talk about herd immunity, it means that our infrastructure are barely even beginning to scratch the surface when it comes to dealing with it in terms of what the facilities we have. So when you talk about herd immunity, how do you foresee a country such as Kenya, a developing country, handling that type of explosive infections? Because at the end of the day, even the young, healthy people do get COVID-19 and they do have symptoms that would require them to actually go and get help.
Thank you. I don't know how you are understanding herd immunity. Talking about herd immunity is not talking about removing the restrictions. We are just saying, if you are talking about herd immunity and that you want your population, those who are infected, to protect those who are not infected, you need 80%. However, things have changed from when we started.
Okay.
One, when we started, we were told we don't need to use masks. Studies in Czechoslovakia showed that using masks reduced this by 40%. Now we are using masks. Two, we did not know what we call the pathophysiology of the disease, and therefore people are using ventilators, and people are trying to budget for ventilators. Yeah. We have since come to realize that the main killer of people with the patients with COVID-19 are clots in the lungs. And therefore the treatment has changed to antibiotics and anticoagulants. That means that we do not need as many beds, ICU beds, as we had anticipated in March.
Right.
We did not need as many ventilators as we had anticipated in March.
Yes.
The other thing is that it is not true the calculations the doctor is making there.
How come?
From what we have seen. When you test, the conversion rate is 2%. When you test 100 people, you get about 2 positive. Out of those 2%, 85% in Kenya will not know they have the infection, because they are asymptomatic. The remaining 15%, most of them will have mild infection. And the ones that end up requiring hospitalization and probably ICU treatment are like 3%. So I don't think that we still need the projections we had at the beginning.
But let's talk about those numbers then. Let's take an example that we can actually point to, because this was attempted in Sweden and we had an expectation of that 80%, but then at the end of the day they wound up with around 7.3, and it is not even known whether that sort of immunity will actually last, because studies have indeed shown that people actually who have tested positive before come back. In some countries there's a second wave and then we have them actually testing positive again. So it means they didn't get the kind of immunity that we'd hope for. Dr. Samrat Shah, would you react to Professor Ayaya's sentiments on there isn't a need to project such dire numbers in terms of possibility of infections if we are to go the herd immunity route?
You see, let's talk about Sweden. As you said, they planned to have herd immunity. As you said, they turned out that only 7% of population were getting infected. And when in that 7% of population itself, the death rate shooted so high that the death rate went to around, I think, 4,500 or 45,000, in that range. Suddenly the death rate shooted up. So when we talk about herd immunity, we are talking about transmission also. We are talking about elderly population getting affected also. As rightly said by the professor, 3% of the population are going to have severe form of disease and die. So when we talk about herd immunity, we are not talking about 1 to 10% of population getting affected. We are talking about 80% of the population to be affected with COVID-19, which includes that 3% of elderly population also, which means we are going to have a devastating death as well. This is one thing. Second thing, the transmission rate for COVID-19 is very high. Even to calculate that herd immunity, there is a formula wherein we calculate a reproductive rate. Reproductive rate means how many people can one person infect. Imagine if I have COVID-19, how many people can I infect? You know, the initial data from Wuhan said that I can infect 2 people. But today the data says I can infect 7 people. When we talk about one person infecting 7 people, it means the herd immunity required would be more than 90%. It means we are talking about more than 90% of the country's population to be infected with COVID-19. So now the question comes, even if we talk about herd immunity, are we able to handle this 90% of population? Are we able to face the death rate that are going to happen because of elderly population being involved in this 90%? Third thing is, do we know how much immunity do we have against COVID-19? When we check the antibody titers, how much antibody titers are required to have that kind of immunity? We don't know this data. Even if you have that data, how long is the immunity going to last? Imagine the influenza virus, it has immunity only for 1 year and then it gets mutated. Like COVID-19 got mutated. If this mutation is going to happen after 1 year, where are we standing after 1 year? Is that herd immunity going to last for 1 year or not? We don't even know this data, whether we'll have herd immunity for 1 year, whether this COVID-19 is going to go for mutation again, whether we are going to have second surge again. We have no data about these things. So when you have no data about these things, we are imagining that we are going to infect 90% of the patient. We are going to have more than 1.2 million deaths. We are talking about recurrence of the COVID-19. Maybe the immunity lasts for 1 year and then we get a second surge. Then where is the herd immunity going to stand?
Professor Ayaya, you do agree that there will be some deaths as far as COVID-19 goes if we allow that sort of approach to be taken up in whatever country, in whatever scenario. Talk about people with cancer, people with anemia, people with sickle cell, people who are vulnerable with HIV, fighting the HIV virus. Yourself, you are a professor who deals with matters children. How do you think that sort of a population that's so vulnerable would fare against this type of approach?
Honestly, I don't even know what we are discussing. You see, the 3% is not 3% of the population. It is 3% of the infected. Then it is not like I'm saying let us stop everything else, let us do herd immunity.
Yeah.
I'm just saying what herd immunity is and how it works.
Okay.
That we are still learning about it is true. We cannot say how long. I spent 7 years training people on immunization. And each disease has a way of you assessing whether the vaccine worked or didn't work.
Yes.
So for COVID, we still don't know.
Yeah.
But all I have said is that given what is known now, is that for you to have herd immunity, you need 80%.
Okay.
But we have put in place certain things. The doctor has said that COVID will, in one COVID patient will infect 2 patients, other people. He will actually infect 2.5 other people. But when we do social distancing, it reduces that to 1.5. So we cannot look at herd immunity in isolation from other things that we have put in place. These other things are also having an impact, some of which we have yet to know what the impact is. But some we know what the impact is. So all those things we have put in place, social distancing, sanitization, hand washing, are also helping us.
Yes.
So it's not like you will just have had the immunity on its own and then the patients are infected.
So in your view, we should couple it with, if it were to work, in your view, we should couple it with other measures that we already put, that have already been put in place. Now,
yes, we have put in place means to reduce transmission. Let me start here. When we started dealing with COVID-19, we were told we want to flatten the curve.
Yes.
What does that mean? What it meant was we wanted to make sure that the projections did not come true. Like when we were told 10,000 people by May will have been infected, we wanted to make sure that didn't happen. We wanted also to put these measures in place to reduce that. And then we were giving ourselves time to learn and understand this disease, understand more about the disease so that we can know how to handle it. And lastly, we wanted to give ourselves time to spread the infection. One, reduce the infections, but also if they are going to be there, they should happen over a long period. So we don't have very many infections at once that will overwhelm
the
our health system. So we cannot discuss herd immunity on its own without considering what else we are doing.
Okay. And you brought up the issue of immunization, and I'd like to bring Dr. Samrat Shah into this conversation. How would the availability of an immunization or a vaccine, to be more accurate, aid in actually going this route? Would it make it more, successful, particularly given that in previous instances, having a vaccine would actually help in breaking the chain of infections and also, help in gaining more immunity amongst the people who have it, because an immunization or a vaccine is lesser potent of whatever virus or whatever infection you're trying to protect the community from.
You see, as we said, herd immunity can be developed only by 2 ways. Either it is by vaccine or it is by infection. Okay. Now, we cannot do it by the mode of infection, because for that you will require 80% of population to be affected with that, which is highly impossible. Even these Lancet and John Hopkins and Mayo clinics have proved it beyond doubt that herd immunity by infection is not playing role in COVID-19. It is going to have a disaster. So when we talk about vaccine, yes, that's the only way we are going to develop herd immunity, like we develop for other viruses for that matter, or measles, mumps, polio, chickenpox for that matter. So definitely if we have vaccine, and if we can vaccinate at least 80 to 90% of population, that is the point when the vulnerability of transmission of infection is going to be less and the immune population is going to be high. So when the immune population becomes high, the rate of transmission comes down. That is when the herd immunity develops. So if we have a vaccine, I think that is the only way we can achieve herd immunity and increase the immune population and decrease the transmission to the vulnerable population.
I would like to agree with
Go ahead.
that, in the sense that obviously when you immunize, the difference between the vaccine and the virus is that the virus causes the disease, while the vaccine has been made not to cause the disease, but it invokes the production of antibodies to fight that infection. Now, where there is a wild virus, the virus itself invokes more immunity than the vaccine.
Right.
Obviously, because it is more potent. And therefore, where you have the wild virus in the environment and then you vaccinate, then your immunity becomes much better.
Yes.
So, I don't think, I didn't sit here to say that we let everybody get infected. No. We need to take into account everything that we are doing. And the government has done well. It has done a lot of things. Even when you talk about whether we shall be able to handle cases, what we have done, if you start with the way we started, where you got positive, everybody in your household was taken to isolation or quarantine and at your cost. As we are speaking now, WHO itself has said that the asymptomatic cases do not seem to transmit that virus. They are saying they are rarely transmitting, which means that will change. Also, the fact that we are now talking home-based care. The government is talking about treating some of those people without symptoms at home. That is going to reduce the need for hospitalization and the need for beds and the need for whatever. So things are improving. The government itself does not realize that it has done so well and it is doing so well. We must look at all these things in the correct context. All the things that we have put in place are working for us. Then we add herd immunity. And herd immunity to me is just a scientific thing of saying, if you are to get herd immunity, how would it go? But we are at a stage where we can't say that for sure we know that if you get these antibodies, they will last this long. The only thing that we are maybe not doing correctly is the fact that we are testing for the antigen, which is the virus itself. Now, you have seen people go to the quarantine, and after 14 days, they are said to be negative and released.
Yes.
Which means that we could be getting a lot of negative people who already suffered the disease and the virus is not there.
Okay.
So this company that I saw coming up 2 days ago to give us an antibody test, I believe that is the correct thing to give us the magnitude of the problem so that we shall know, because when you do the antibody test, antibodies are the body's reaction to the antigen. The antigen is the infection.
Yes.
And then what you produce to fight that infection is the antibody. So when you do the antibody test, you will be able to know who has been in contact with the virus, even if the virus is now not there.
All right.
And when you, like if you are to ease the lockdown and these things, people would get infected. People are getting infected. But most people would not even know it.
Okay, now, Dr. Samrat, I'd like you to comment on that, the testing of antigens as opposed to antibodies, which is better, and would that make things better in terms of tracing how far the spread is, and also weigh in on the matter of asymptomatic patients. Do you think that indeed there are lots of us who are not actually exhibiting the actual symptoms and are not being bedridden by this, and does that bode well for the probability of just taking care of people who test positive at home?
You see, antibody testing is going to be really helpful task because one, there are two ways in this. When we check antibody titers, there are two types of antibodies we check in this titers. There is one called IgM antibody. There is something called as IgG antibody. So when we have those testing facilities, we can even get to know whether it is an acute infection or this person got infected right now, or it is because of the old infection and he has already developed immunity against him, so that we can even try to extract plasma from the patient and give it to the patient who is vulnerable or who is suffering from COVID-19. So antibody testing is going to definitely tell us how much amount of patients we have, and it's a rapid diagnostic test, very cheap test, does not cost, it's not very expensive. So I think it is definitely going to add a lot of disease-free burden and lot of this one to us, because once we have those kits, we can check a lot of population compared to what we are testing right now. So we can get a good number of cases who are positive, we can get a good number of patients who are immune to it, and try to take the plasma from them and transmit the plasma from them to these patients also.
And how about home-based care? This is an option that the Ministry of Health is actually looking into quite seriously. Do you think this is something that the country would be ready for?
Home-based care, as of now, you see, even developed countries like UK and US, they have adopted home-based care for those patients who are asymptomatic, for those patients who are having mild symptoms, provided they are very serious about this and provided they take care that they are not going to transmit this infection to other communities or other people who are vulnerable to it. That is definitely a choice, because as the number of cases are going to increase, I think we need to go for home-based care, because we may not have that much facility or that much healthcare sector to take care of all those who are coming positive.
Oh, yes, Professor, I had something to add to that.
Yes, I was going to say, thank you, Dr. What he has said is true. The thing about home-based care that is difficult is that the majority of the patients cannot do it, because the majority of our patients are in the low-income
bracket. Yes.
If you go to the slums, Kibera, one house, I mean, it's one room thing, and you have 5 people or more in one room. Where are you going to get that room where the patient should isolate himself? So it will be good for those who are middle class and above, but for the actual patients who are the majority, then it will be still difficult. I know people are talking about some community or whatever, but that will still be a bit difficult, because it will just be like hospitalizing them again. But for the people who can afford and who have houses with several rooms and can do that, then that will work well.
Absolutely. And perhaps as we go forward, when you look at the mass testing that is ongoing, some people are going for it voluntarily, and others, of course, being forced to it based on how prevalent it is in their areas. How do you think the approach is going right now as far as the local communities are, and what changes could we make to make it even better?
On what testing?
Mass testing, yes.
Okay, mass testing. We're actually not doing mass testing, because mass testing would mean we try to test everybody in Nairobi and everywhere.
Yes.
Which we are not doing. What we are doing is targeted testing, where the government, the ministry decides that Kibera could be a hotspot or could have many cases.
Yes.
So let's go to Kibera. Truck drivers are another group and so on. But I think, you see, to what avail are we doing the tests? Because if you want to know how many of your people are infected and therefore could have that herd immunity, you would have to test 40 million. We cannot test 40 million.
We don't have the capacity.
But when we get the antibody test, we could test many more.
How come? How come?
Hey, it is cheaper, it is faster. I mean, you see the way you do the HIV test, and in 1 minute you have the result.
Yes.
This one, how long are people queuing at Busia border? So it is cheaper. We can test more. But my take is that we stop testing the way we are doing, and then we only test, if we are going to use what we are using now, we only test patients who come to hospital with signs and symptoms of COVID. The ones who are suspected of having, just like we test you for malaria if we think you could be having malaria. So we test those, and then test the truck drivers, because they are crossing the borders, and we have agreed with our neighbors that we shall test, and when they are positive, they don't cross the Nene. Then for knowing, we still have to learn what we call the epidemiology of this disease.
Yes.
To understand who gets infected, who gets mild symptoms, who gets severe symptoms, and who dies.
All right.
Things like that. So to be able to do that, then we can do a randomized study where we calculate the number of people we need to test, to study, and then we study them from...
A sort of sampling.
Yes.
Of
and
the
then
population.
We can learn about that.
Okay, Dr. Samrat Shah, do you agree with the professor's sentiment on how we should approach testing? And what's your take on the ongoing mass testing process that's ongoing in the country?
I definitely agree that this is not the mass testing program what we have. It's a targeted testing program. Mass testing means we would test a lot more number than what we are testing today. So I think the testing facility is still lacking, definitely. But I think if the antibody testing facility comes to our country, and if the antibody diagnostic test kits are approved, and if they are very cheap kits, they are not very expensive, even the test is very cheap, I think then we would be able to test a large number of population, provided we get the testing facility where we are able to check both the antibodies, IgG and IgM antibodies, because there are some kits which are only diagnosing whether you have antibodies or not. So when you have that kind of kit, it will not tell you whether you are infected acutely or you still have this infection or you are immune to it. It does not say anything about it. So I think when we get those kits, we should be very much specific that we get two separate kits. We can check the IgG antibodies and IgM antibodies. That is one thing. Second thing, antibody testing is definitely going to change the way we are looking at the things now. I think we'll get a lot more number of patients coming out positive with it, and a lot more number of patients who are immune to it. Definitely is going to add benefit to us.
At the same time, I'd like to point out a trend that has been reported, and people are actually staying away from hospitals because they feel that that is where they would actually get infected by the virus. And we have been told there is evidence that actually medical practitioners are also getting infected, almost 100 of them. I think we were at 81 the last time we checked, if those numbers are anything to go by. So what is your take on that particular trend, patients staying away from hospitals to keep themselves safe, but of course they have other problems that they need addressed?
Sorry, was this for me?
This was for you.
Yeah, okay. So this is true that so many patients are avoiding coming to hospitals with the fear that, one, I might get infection, two, with the fear that I might be tested for COVID-19, three, with the fear that I might be tested positive and I might be sent to a government health facility like Kenyatta or Bagati for that matter. So these kind of fears are definitely there in people. So what needs for this is to have a public-private partnership and have a lot of testing facility in each and every facility for that matter, maybe government or private for that matter. And we should have more and more COVID-19 hospitals which can admit COVID-19 cases, so that all these fears are coming down. That is one thing. Second thing is, I think there is still need for people to be educated about COVID-19, because we see a lot of people coming to our hospitals and telling that, don't worry, Corona is not going to come to us. Corona is not going to be seen in this kind of population. Corona is not going to be seen in this tribes. So I think there is lack of still a lot of awareness about the coronavirus in the peripheries as well. So one, we need to increase the awareness about the COVID-19 to the people. And two, I think public-private partnership will play a bigger role, because we need to have larger number of facilities, larger number of testing facilities, and larger number of hospitals who can treat COVID-19, so that that stigma is coming out from the people.
Sayaya, what do you make of that particular trend?
That's a very important bit of COVID-19. You see, the way we started was wrong. We put in place a curfew and told the police to, I don't know whether we told, but then the police went on to brutalize the Wananchi. We tested people who became positive, took them to quarantine at their cost. Then we brought in their contacts at their cost. And that made people, that stigmatized the whole thing about COVID. And so people are afraid of coming to hospital.
Yes.
Because one, they're afraid that if they are tested and they are found positive and everybody in their home has to be brought, who will pay for it? Two, they are afraid of getting COVID from the hospitals. And you know, even the health workers are at risk, because with 85% of people not even having a symptom, it means that even if, as a pediatrician, somebody is bringing me a child, that father of that child or the mother could be the one with COVID.
For sure.
Right? But I'm going to test the child or something like that. So it becomes rather tricky. So that has made it very difficult for us even to test. You have seen even in Isili, people stopped going to be tested. Mjiwakale, people refused to be tested, and all these places and so on. So that has been a problem. Now, the other problem, because of that, you have to remember that the common diseases that kill children, diarrhea and vomiting, measles, malaria, pneumonia, and malnutrition are still there.
Yes, for sure.
And they kill these children when there's no COVID. What about now that people are even afraid of going to hospital? The other people are the elderly and whatever, the people with comorbidities, the diabetics, the hypertensives and whatever. If they are missing to go for their normal clinics, when we open up, we could find that a lot of people died of that. And that is a cost that we should think about when we are considering the possibility of easing the restrictions. Because I can imagine the number of children we will find died during, during of hunger, because the amount of food that is being given as a donation is not enough.
And most of these kids actually feed at school, so
a lot of them get something at school.
Ripple effect. Now, I'd like your closing remarks on herd immunity, because we are actually running out of time. Just briefly.
My closing remarks are this: that when and if we test, we should not alarm the public that we are getting more cases. The cases will increase, but that will not be a bad thing, because we'll be working towards herd immunity. So we should not, should we decide to ease restrictions, we should expect the cases to increase, and when we get them, we should not be afraid. And the other thing is that I recommend and I suggest that we stop the current way of testing. If we get the antibody test, then we can use that. But right now, using what we are using, let us test the truck drivers and the suspected COVID cases that come to hospital.
Okay, Dr. Samrat Shah, could you give us your closing remarks?
I would say, as of now, we should concentrate on what Ministry of Health is telling us to do. All the public out there should listen to what Ministry of Health is telling us and listen to it and take it very seriously. And about herd immunity, I think we are still very far from herd immunity. So let's wait for the vaccine to come for it, and then we can have a mass immunization program. But as of now, let's go for what is required to do. Let's volunteer ourselves and tell the government of Kenya or the ministry or the hospital that, see, this is the patient who is suspected, this is the patient I am having. Let us volunteer, unless, because volunteering is very important right now. Unless we come forward ourselves, this disease is not going to stop. So let us do what is required to do from our side as well.
All right. Thank you very much. That is Dr. Samrat Shah, who's a medical doctor. And also in studio, we have had for this discussion Professor of Child Health and Pediatrics at Moi University, Samuel Ayaya. Thank you so much for your indulgence on this particular topic. We're going